is Jen Story, and I'm a physical therapist at Mangiarelli Rehab. I'm licensed in dry needling, and I've done this for almost 10 years now. And today we have a client who's having some right cervical neck pain, mostly levator scap and upper trap. She thinks possibly from sleeping on a pillow that maybe is too old, or she just needs to go out and buy something a little more firm. So what we do is we take these needles, they're acupuncture needles, but this is not acupuncture. I just want to clarify that. Acupuncture is more of a Chinese medicine technique that they follow meridians or pathways. Dry needling, we try to follow the nerve pathway. So it's just a fine filament needle. I used 1-inch needles on Patty today, and we just insert them into the skin and into the soft tissue. So by making this micro lesion into the soft tissue, the idea is that it sends a signal to the brain, which help release this nitric oxide to the body to help reduce the inflammation and the pain. I also try to find trigger points or taut muscle bands, and I try to find those spots and insert the needle there to help break up that adhered tissue. Sometimes you'll see a twitch response. It's not all the time. If you do, that's a good thing and you've hit a good spot, but it's not something that you really need to focus on. So I also, to kind of accelerate this process a bit, is we have her hooked up to some electrical stimulation. So it just makes it a little more intense, really stimulates the muscle and the soft tissue a little bit more to help with the pain and the healing process. Usually this process takes maybe 10 minutes. After this, we'll take her out to the gym, instruct her on some exercises to work on her posture, her strengthening, and then maybe end with some ice or electrical stimulation, whatever we need to supplement her treatment. So this is just one of the many things that we offer here, and if you have any questions, please feel free to call and we'll be happy to help. Thank you.